I was surprised that I had a problem that was cardiac related. I've had a lot of pulmonary problems, but never had a cardiac problem. My name is Glenn Harrison. Last year I had a stent placed at Newark Beth Medical Center. Subsequent to that, I've been going to cardiac rehab at Monmouth Medical Center, Southern Campus. I was born in the hospital now known as Monmouth South back in 1955. I had medical problems as a child, most notably asthma, and I spent a lot of time there, and I've been using this hospital ever since, including my cardiac rehab. Last year I was making arrangements to have a minor hernia operation. It was explained to me that I should get clearance from various doctors, including cardiologists. The cardiologist found that I had a blockage in an artery. As a result, he sent me up to Newark Beth Medical Center. I was there by 6 in the morning, I was home by 6 at night. It was a painless procedure. It seemed pretty clear that I had to get a stent put in, and it also seemed pretty clear that this was not something at the moment that is life-threatening. The explanations of what was going to happen were thorough. Dr. Cohen was the doctor performing the procedure, and he took the time to answer questions. Overall, it was a positive experience. It's nice to get into a hospital the same day and leave the same day and not have to start staying overnight. Once I came back here and conferred with my cardiologist, he sent me over to Monmouth Medical Center South for rehab. Cardiac rehab is a series of exercises on these machines to kind of raise your heart level to make sure that you're doing well. And they start you off with like a warm-up, and then they raise your heart level to a certain degree based on the amount of time or the repetitions or the level of an incline, for instance, on the treadmill. When I started out doing it, I was starting out at like 1.5 and then at 2.4. Now I'm up to 3.4. Also, I started out doing it 6-7 minutes. I'm up to like 15 minutes now. The people that work there are extremely helpful and care about the patients, most notably Hazel and Diane, who have been my inspiring leaders of my rehab. Based on the location, based on the treatment, based on the people that work there, and based on the results I've been having, I will be continuing to go to cardiac rehab. I want to keep my heart going and avoid any more plaque buildups. I realized that the stent I had was a minor procedure compared to what many people go through. I don't want to reach that point. I want to maintain what heart health I have and try to increase it.